closures for Columbia County businesses at this time. But we feel as a commission that it's necessary for us to hold this press conference to address the concerns and questions of our citizens. We just want to let everyone know what we're doing. But before I begin, I just want to introduce the other elected officials here. I have Vice Chairman Gary Richardson, Commissioner Trey Allen, Commissioner Connie Malier, and Commissioner Dewey Gailey. First, let me begin by saying that we're very aware that we're in uncharted and potentially dangerous waters, and every decision made at any level can have serious repercussions. So let me be very clear. Any suggestion that Columbia County's priority isn't the safety of our citizens couldn't be farther from the truth. We've closely monitored the progression of the spread of the virus for weeks and have continued to follow the guidelines set forth by President Trump, the Center for Disease Control and Prevention, Governor Kemp, and the Georgia Department of Health. As a result of the information being provided, we've taken several initiatives to safeguard the populace. First, we as a county have taken the initiative to partner with MedNow to offer on-site mobile testing center in Columbia County. Since tests will be limited in the beginning, they will be administered on an as-needed basis at first, then expanded to other Columbia County citizens. Of course, more tests have to become available. We're taking action independently of any other government agency because we feel such a responsibility is too important to wait on other approvals for help. We've also taken the initiative to implement the guidelines stressed by the experts for all Columbia County employees. We've closed all the venues. Given the guidelines to ensure compliance. These guidelines include the importance of social distancing, staying at home if you're sick, staying out of emergency clinics and emergency rooms, calling your primary care physician should you feel any symptoms, disinfect and sanitize as often as you can, and discourage gatherings of more than 10 people for Columbia County employees. When it comes to individual rights, I, along with my fellow commissioners, strongly encourage responsible behavior by our citizens, businesses, and industries. In the best traditions of Columbia County, we've set a great example for how our local businesses are policing themselves and adapting their operations to ensure the health and safety of their patrons. As most of you know, many Columbia County eating establishments are operating with closed dining rooms and drive-through service only. Other local restaurants are offering curbside or delivery services while also exercising innovative practices to slow the spread of the virus. Our only movie theater in Columbia County has voluntarily closed. And while we encourage every business to follow the CDC recommendations and do what's right for their neighbors and employees, we feel that if they are taking these recommendations, they deserve the right to do what's best for them. As a commission, we believe we should govern by example and govern by example and encourage and not mandate. No government can protect those who won't protect themselves. It's important to give private industry the opportunity to do right. It's our experience that most of the time, the people and business leaders at Columbia County will put the community first and make the right call. However, we do understand this is not always the case. So in Columbia County, we're going to follow the law. That says Georgia Code does give us authority to make and amend rules and regulations as necessary for emergency management, and that exactly is what we intend to do. To this end, we've directed staff to institute special rules that will apply to everyone that holds an occupational tax in Columbia County. These rules will mandate that all Columbia County businesses adhere to the guidelines that they have established and shared by the CDC and the World Health Organization, to not put patrons and clients at risk. Obviously, some businesses such as healthcare, childcare, groceries, pharmacies are exempt. To some extent, even those businesses, they have responsibilities that they have to comply with. If there's a business that's still open that's not operating under the recommended guidelines, we intend to use our enforcement staff to gain compliance. Those that still do not comply will risk losing their occupational tax license and the ability to operate in Columbia County. We're committed to following up on all violations of guidance and will do everything within the power to gain compliance. Frankly, the easy thing for us to do as a governing body would be take political actions and make false promises to citizens that we may not be able to legally enforce. Instead, we've chosen to do the responsible thing and work with the people of Columbia County during this crisis. Only working together can we succeed and continue being the leading community of our region in liberty and safety for our citizens. This is not the time for feel-good facade. It's time for each citizen to examine the facts and follow the recommendations of experts. It is irresponsible to potentially adversely impact the hardworking business owners of Columbia County by having their clients simply go to a neighboring county or city. The only way for closures to be successful is if every business in every jurisdiction took a pause at this time. We understand that's not realistic. We understand your concerns about keeping certain businesses open during this time, and we read every comment, every email, and every text messages. No one here is advocating that anyone's visit an open business that you should decide is not in your best interest. We honestly hope and feel that most Columbia County residents realize that we're just as eager to beat the pandemic as everyone should be, but with some sense of normalcy and private rights intact wherever possible. Please take care. We wish you and yours wellness and safety and in God's hands through these trials. May God bless Columbia County, Georgia, and the United States of America. Now we'll answer any questions that you have.
Chairman, can you talk about specific guidelines for businesses that they'll have to follow for safety measures, and if they're not followed, you guys will go ahead and enforce those, and they've got the potential to lose their license. What
That's
are those
correct.
guidelines?
Well, we have staff that go in and verify, are they following the CDC guidelines? If they're not, then staff can go in, write a citation, and we can revoke their license to do business in Columbia County.
What specific guidelines as safety measures, though, are being taken?
Scott, you want to come speak to some of these? You gotta stay away 6 feet from me, though. So.
So my direction from the county commission has been that we will follow the CDC guidelines, and the specific question was, how are we going to enforce that? Gatherings of more than 10 people now are going to be discouraged. If we see a gathering of more than 10 people, we're going to go in and we're going to break that gathering up. We want people to stay 6 feet apart. We want to encourage hand sanitizing and hand washing and those sort of things. So as we get calls or we get people that are not operating within the guidelines that have been placed forth by the CDC and the World Health Organization, we're going to follow up on those individually. What that will give us the opportunity to do is to allow the business that is operating within the guidelines to continue to be able to do that for the essential needs of our public. But anybody that's operating irresponsibly will risk losing their ability to do business in Columbia County in the future, much beyond this pandemic.
Who will be enforcing that, and how will you guys know if a business is not? Is it all reports for people?
At this time, our code enforcement staff will be working on that. We have extra staff that we're going to be bringing in. We're going to be spot checking businesses in addition to fielding 311 calls. So if a citizen sees a business that is not in compliance, we want to get a 311 call. We plan to visit that business. There are things we're going to have to do to make this rule, or to implement this rule. I guess the commission is going to have to take action, but we've already been directed to implement this in an emergency procedure. So we're going to implement it at this time. We'll follow up with more specifics at a later time. But we're going to do spot checks. We're going to have follow up on any calls that we get, any complaints that we get. We'll take care of those as they come.
Why do you guys close down the government buildings but not the businesses?
Again, that was a socially responsible thing to do for us, because we feel like it's in the best interest to not have people come to these government buildings to do face-to-face transactions. We've only done that until next Monday. Depending on what happens, we may open up on a limited basis next Monday, but at that time we will be prepared to be able to make sure that we comply with these same rules that we're putting in place for other businesses. That may be that every employee is wearing gloves. That may be that every employee is wearing masks. We're not going to allow more than 10 people in the lobby of a building at a time. So we're going to actually implement the same rules, or use the same rules on ourselves. That said, any business that wants to voluntarily close can actually voluntarily close. As Columbia County has chosen to do it this time, they can absolutely do that as well. They're just not going to be able to operate outside the guidelines of the CDC.
And for test kits, do you guys know exact locations of where they're going to be at yet?
So we're working on that now with our partners at MedNow. They've reached out to us, and we're working on a partnership. We are working on locations. We're trying to find something centrally located in the county, but we have not. We don't have a definitive answer yet. We should have it this week.
It's a secret, Richmond County and Columbia County are close and people go from county to county. Does this difference in ordinances or difference in orders between the counties, is that how are citizens supposed to, able to differentiate going from county to county? Does this make it unsafe for those measures being taken in Richmond County? Have you guys communicated with the mayor there?
So I'll let the chairman answer as far as the communication piece, but I will tell you as far as how we're going to communicate, how we're going to do things in Columbia County. There are businesses that are still open in Richmond County today. We would hope that they are actually working along the CDC guidelines as well. Every business in Richmond County is not shut down. Every business in McDuffie County and Lincoln County is not shut down, just like Columbia County. So we would hope that the ones that are still operating, that have to operate, are operating within these guidelines. In Columbia County, we want to set the example. We want to implement a rule that we're allowed to implement by law to say that we're going to have these rules in place and you will follow them if you're in Columbia County, if you're in a business. I'm not sure that any other government has done that at this particular time. There have been closures, but there are still businesses open. So what about the ones that are open? Are they following the rules, and how are those being enforced? That's the way this commission has decided to approach it, as opposed to just a mandatory shutdown or picking and choosing what businesses to close.
Do you guys see a curfew in the potential future?
I can leave that up to the Board of Commissioners, but I haven't been advised that.
Is the county doing anything to coordinate with area hospitals?
So what's the question, Susan?
Are you working with area hospitals in the event that you need to send a lot of people there?
So we understand that actual hospitals right now, the emergency room visits are actually lower than they have been in quite some time. So we still have our partners in place. We still, I mentioned that we're working with MedNow. We have MedNow facilities in Columbia County. As you all know, we do not have a hospital in Columbia County. But we do have urgent care type facilities, so we're using what's at our disposal now. I am certain that the hospitals in Augusta, though, being the high caliber that they are prepared and continue to prepare, and we'll continue to have conversations with them as the day and weeks go on.
Close contact businesses like salons, places where people are touching the customers, what about those? Are those able to stay open, or are those going to be in those guidelines?
So the same thing applies there that we're talking about. You could argue that a grocery store is a close contact business as well, because you're conducting a transaction with somebody across a counter. So what we're doing is we're encouraging, even those places will have to comply with these rules. So for a salon, if it's an individual, one person going into a salon with one stylist in the salon, neither one of them have symptoms, both of them are taking proper measures, they're not more than 10 people in the lobby, we would expect them to be able to conduct their business. What would be irresponsible is to have 25 people in a waiting room, and somebody that's maybe potentially ill or has a fever working on those people that are all lined up in that waiting room. Those are the things that we're going to try to combat. But to pick and choose, say we're not going to do it for this business, but we are going to do it for that business, makes it extremely difficult, and I think more confusing for the citizens of the county to decide, well, which business can I go to and which one can I not go to?
Is there somewhere where citizens and businesses could find these guidelines? Will businesses get a list of guidelines?
Absolutely. So we'll be working on that today. The commission has given us the direction. We've been working on this over the weekend. Staff will be working very hard for the rest of the day to be able to get that stuff up on our website. We'll share that with our news partners, so you'll be able to get that up on your website. We invite any calls to go to our 311 center. If people have questions about specific businesses or rules, our 311 center will have the rules laid out, and again, we intend to enforce those.
What's the most important thing about keeping commerce alive in a time like this?
Well, you think about that from a high perspective, and again, I'm going to turn this back over to the chairman, but some people are extremely dependent on their ability to be able to do their business. Not to mention, we have the issue of people needing services. Again, if we had every county or every state or every place in the United States, if we all paused for 2 weeks and we all self-quarantined for 2 weeks, then that would be a different story. But to have Columbia County businesses arbitrarily shut down or have people lose their livelihood when they had the ability to operate safely, I believe is irresponsible. And I'll turn it back over to Chairman Duncan.
I've received just as many emails from folks thanking us for our stand because they have to earn a living. They have to feed their family. A lot of people live paycheck to paycheck. So it's a fine edge to walk down this path with this virus with folks who say, I can't feed my family. This is going to turn out very poorly for us. And so we just have to balance those two. It's not an easy task, but we're committed to, it's not about business owners, it's about the employees who work with them. And then you think through the food chain of the economics of that situation. This business buys from this business, it buys from this business. The roller coaster or the tidal wave effect of taking out all these small businesses, which frankly I think are the backbone of the U.S. economy, is something that we're just trying to work through and prevent.
Is there a time where all of this could change if things do progress and get worse? Will harsher measures be taken, or is this kind of going to be the path moving forward?
Everything is still on the table. Absolutely.
So how do these guidelines apply to daycare facilities that may house more than 10 children?
Well, with daycare facilities, again, there are certain things they do have to do, but we're focusing on the businesses that we can impact.
What does that kind of mean for them?
They're going to have to comply any way they can. Oh, I'm sorry. Sorry. I need a bit of mine. So, at any rate, daycares are going to have to comply within what the rules and regulations they have within how they're governed, but we will pass these rules around to them as well. So,
We talk about no more than 10 people in a business. Does this apply to grocery stores as well now too, or?
the grocery store would be an essential business.
So this is non-essential business.
Correct, essential. And you bring up a good point. The reality of closing businesses, there are really only a few in this chain we're talking about. Really, if you look back at what other counties have done, there's a few big classes of business. Anybody here gone to a grocery store in the last 2 weeks? I haven't been in one where there are not 200 people. So how does that impact the spread of the virus? So we're just asking folks Columbia County citizens to take a step back and look at reality and know that if you're going in these places, and I think Scott mentioned earlier, probably the only totally effective solution would be to shut the whole world down. Well, how are you going to get people food if they can't go to their grocery store? If they can't go to get their medicines at the location where they get it? So, again, there's not just a one-size-fits-all simple solution when you're trying to protect people's jobs as much as you can and protect the public. I reiterate the point that the government cannot protect folks who are not willing to protect themselves.
What's the essential business? The county.
Well, we're following the guidelines, but you got health, you got food, gas stations, medicine. So, I mean, there's a basic list.
There's some restaurants that still do dine-in.
Correct.
We were getting a lot of Facebook comments about how that's going to be a large crowd because maybe a staff is 10 people or less.
That's going to be a challenge for those restaurants.
So they said
We're going to be addressing that with them.
okay.
Unless they have to follow the practices. Can they separate? Can they have the separation, the physical separation? I've been in one or two to check it myself, and I went to one, and I named in particular. They were doing fantastic. I assume they still are. The tables were spaced out. If you ordered something, everything, they had gloves. You had plastic utensils, paper plates. If you wanted salt, even the package. So I mean, they were going out of their way to comply and ensure that they could stay in business. Those are the places that we want to keep in business.
Just to be super specific, we're talking 10 or no more than 10 people in a business. Does this mean if businesses do want to stay open, they'll have to shuffle in people and out? Is that
They will have to work through that themselves, yes.
What are you doing to protect the first responders?
First responders have all the PPE required by their work set or by their fire department at the fire standard. So they have the personal protective equipment.
Are you working with area counties? Is there some sort of regional plan to kind of deal with this?
Regional plan, no. But I have been in touch with Mayor Davis. I was aware they were going to implement something on Saturday. I didn't know what it was. I found out when you guys told me. Thank you, everybody, for coming out today. We appreciate it. We're going to get through this. It's scary for some folks, but I just want to assure them that we're on it. These are good guidelines we're following. And again, together we're going to get through this. And we'll be fine. Thank you.